Okay, let's talk about the IUS. What's an IUS? An intrauterine system. What does that mean? It essentially means a coil with hormone in it. Now, until recently, we only had one type of IUS. You may have heard of it, the Mirena, but now we have its little sister called the JDES. What's the difference between the two? Well, this is a Mirena coil. It lasts for 5 years, and what happens with this is it releases hormone and people's periods get lighter and lighter and lighter, and then usually they'll stop altogether. But at the beginning it can be a little bit erratic, so after it's fitted, if you've got a little bit of funny bleeding, don't panic, that can be normal. But if you're worried, of course come back and see us. Now your other one is your JDES. It's got the same hormone in, but at just a slightly lower dose. That means it only lasts for 3 years. And with this one, people tend to get a regular period, but it's often lighter. So discuss with us which one you think is best for your needs. How they work? Well, they have hormone, and what that does is it thins down the lining of the womb, so it stops an egg from implanting. In a lot of women, it also stops them ovulating, so if you don't release an egg, you can't get pregnant, and it changes the mucus in the cervix to stop the sperm getting through. So they're really effective methods of contraception. In fact, the Mirena is deemed more effective than even being sterilised. So loads and loads of benefits with these. When these methods are removed, fertility comes back to normal. So even if you're thinking about having a family in the near future, it's still a really good and viable option for you. Risks. So there are always risks with anything that we do. When we put it in, if we push too vigorously, we can cause what we call a perforation. That is where we go through the lining of the womb. The risk of this is thought to be about 1 in 2,000, and the risk is higher in people who have maybe just had a baby or who are breastfeeding, but that doesn't exclude you from having one fitted. There is also a risk that if you were to get pregnant with one of these devices in, the pregnancy is more likely to be out with the uterus in the tube. But if you're not on contraception at the minute, your risk of that kind of pregnancy, an ectopic pregnancy, is far higher now because you're just not likely to get pregnant with one of these in. But if you were one of those unlucky tiny minority, it is more likely to be outside the womb. They can fall out. The quote is 1 in 20. In real life, I think it's much, much less than that, but I've got to tell you what the books say. When it's fitted, there will be threads attached to it, and these hang out of the cervix into the top of the vagina. And what we tell you is every month or so, feel inside, make sure you can feel the threads. That way you know it's still in. If your threads get a lot longer, or you feel something hard that feels like the head of a match, the coil may have slipped down. So have protected sex or don't have any sex at all and come back and see us. Putting anything into the body that shouldn't be there, there's always a slight risk of infection, but after 14 to 20 days, this risk goes back to normal. But if you did notice any flu-like symptoms, horrible discharge, again, come and see us. So what's it like having one fitted? Well, I can guarantee it's not as bad as what you're going to read on Google. Yes, it's a little bit uncomfortable, but we fit loads and people get up and carry on with their normal lives after they're fitted. We advise to take some painkillers, paracetamol, ibuprofen, about an hour before you come, and don't plan anything too extravagant for after the visit. I've had people have job interviews straight after. You may just not feel entirely up to something like that. What we do, we put in the speculum, which is a bit like having a smear test, and then we clean the inside, and then you feel a pinchy feeling, and that is us holding the cervix. And then you're going to feel a couple of crampy feelings, one where we measure the womb, that gives a bad period pain, and another when we fit the device. If we need to, we can use local anaesthetic gels. We can even insert anaesthetic into the cervix to cause a block if you are in discomfort. But the main thing is you communicate with us. You'll be awake, you'll be alert, and you can tell us if you're in too much pain, you want us to stop, whatever. But honestly, we fit loads of these. Most people with simple painkillers are absolutely fine. Don't have sex or use tampons for a couple of days after we fitted these. And equally, it's going to take 7 days for the amount of hormone to build up in the womb in order to give you contraceptive cover. But IUSs are fantastic. They give you the contraceptive cover, but most of the hormone is not absorbed into the body, so people tend to get very few hormonal side effects from them. They're completely reversible, so once they're removed, you can get pregnant. They're long lasting, whether you go for the Jade SP at 3 years or the Marina 5. So they're a really, really good option. So if you're thinking about this, great plan, come and discuss it with us, and we'll see if we can get one sorted.